Venatius. Please, time is yours.
Thank you very much. Let me see if I can find my... I'm coming. Sorry, I can't find. I am coming. I think, can you see me? Can you hear me?
Yes, sir.
Okay, if you can hear me, thank you very much for this conference today. Thank you for the moderation. I want to use this opportunity to first of all thank the organizers of the conference. My name is Dr. Arief Venatius. I am participating in this conference from Nigeria. Thanks also to the University Malang there in Indonesia for organizing this conference. I think let me start from the theme of the conference, which is very, very interesting and important, and which also demonstrated the need of the time. Innovation in health and education, harnessing technology for global advancement. We are in a time where computer and technology is almost taking over all the facets of human endeavor. We are in a time where we just cannot do without the use of technology, especially as regard to communication technology, which is ICT. I would not like, because of the theme of my topic, I wouldn't like to dive into more intricate areas about technology, especially as it has to do with the Internet of Things, as it has to do with artificial intelligence, big data, analytic, and I think robotic. I won't want to go into that. I am here to look at childhood development in the 21st century. What
Recording
is the
in progress.
Yeah, childhood development in the 21st century. What is the role of technology in health and also the role of technology in education? Many people, many scholars, many proponents have held the view that rather than looking at the advantage of technology, a lot of people have come up to also say why technology provides a lot of advantages, why it has a positive role in the society, it also plays a negative role. And when they looked at the aspect of the negative role, they decide to talk about technology causing sight problem, technology causing obesity, all creating harmful behavior in children. But they have failed to look at the positive aspects of technology. And that is what I am not here to look at the negative aspect of technology, but we will see how we can look at the positive aspect, the good side, the good roles of technology. But first of all, before we continue, let us look at and try to clarify certain concepts, especially as they have to do with the subject which I am here to present. one of the first concepts we should first of all have an understanding about is what is childhood development. Because we are looking at childhood development in the 21st century vis-a-vis health and the role of health, technology in health and in education. We must first of all understand the concept of childhood development. What is childhood development? Childhood development is simply a process. It is a process whereby children grow from infancy to childhood, how children grow from birth up to adulthood. That is childhood development. So that from infancy, they move to toddler, they move to adolescence, they move to, to children, they now move to adolescence, and then move to adulthood. That process of their growth, that process of their development. What are the things that takes place there? Children do not just only grow. Why they grow? Certain things occur, certain things happen, certain things come to play. And those things that come to play also aid in the development of the children. Why they grow physically, in stature, in height, there is also the need for them to grow intellectually. They grow even in language, they grow even in social development. So from there now we move to what is the next concept to look at is what is 21st century. Now, when we are talking about childhood development, and we are talking about it now and in the 21st century, why are we so interested in the 21st century? Why didn't we talk about the 20th century? What is this 21st century? It is a century that started from January. It is a year within the period that started from January 1st, 2021, and it is expected to end in December 31st, 2100. That is 2100. That is when that particular years is expected to end. That is called the 21st century. Then why are we so particular about this 21st century? In fact, it is in this 21st century that we have a lot of innovations, especially innovations in technology. It is in the 21st century that we have a lot of development taking place. It is in the 21st century that we have a lot of ideation, so many ideas coming up, so many trends in technology, many trends in education, many trends in health, trend in economics, trend that moves the world. It is in the 21st century. We never had, even though we had some technological trend in the 20th century, it is not as compared to what we have in the current century. It is in this current century that we see a lot of positive advantages of technology, where we talked about the Internet of Things, where we are even discussing the AI, artificial intelligence, where we have robots taking over human activities. All of these are happening in the 21st century. Now we move away from there and begin to look at another concept. What is technology? Remember, we need to build and understand all these concepts for us to begin to look at the role of technology in health and in education. What is technology? It is just simply the application of scientific knowledge for practical purposes or application. Now, we have dealt with a lot of issues in science, especially in elementary science. We've dealt with a lot of scientific issues in physics. We've looked at a lot of scientific issues in chemistry. We have looked at scientific issues in biology. So the role of technology is to pick all these theories of science in all of these various subjects, try to make them tangible, bring them tangible in form of using those knowledge to produce objects, using those knowledge to produce components that can satisfy human need and human wants in the society. Now, what are the areas, when we talked about this technology, what areas needs the use of technology? We have technology in agriculture, we have technology in education, we can see technology in transportation, technology in communication. Today we have technology. In fact, the manufacturing industry cannot do without the use of technology. Even the health sector, in fact, cannot even do without the use of technology, and many other facets of human endeavor. In commerce, we have technology and many other places. So we just cannot do in this 21st century without the use of technology. In fact, technology has even come into existence to to help ease our way of doing things. How we used to do things in the analog, in the dark age, in the past age, through the analog means. Technology has come to even help to give us, to help to make it easier for us to work and function and deliver. Now we move away from there to what is even the concept of health. Let us understand this concept of health. Health is a state of complete physical, mental, and social well-being. It is the point where we are looking about childhood development, how children grow from birth up to adulthood. And we have established here that in that process of growth, many things are keyed, many things are input, many things come into play to make the child a better person. Now, for the child to go through learning, go through all of this process, the child needs to be in good health. The child needs to be in sound health. Now, being in sound health at infant stage, at what stage? At the toddler stage, at the children's stage, from age say 3 to 11, and also at the adolescent stage before even the child moves up to the adult stage. So at all of these stages, children need to be in good health. While they go about education, they need to go about education in sound mind, in sound health. Why they go about living, developing from all of these stages to the adulthood stage, they need to be in sound health. Whatever activities that they get themselves involved within this period, they need to do these activities in sound mind, sound health, and they need to go about these activities also in having the right type of education that will transform them into the better person that they ought to be. From there, we move into what are these types of technologies in health. Today, we have a lot of technologies in health. In fact, the health sector had migrated from the analog way of getting things done, especially here in Nigeria. They are beginning to imbibe technology into the practices of healthcare system and to advance technology for global, to move technology for global advancement. One of the technology, like as it used to be before, when medical professionals, say doctor, nurses, wants to take information about a child, they do it manually by bringing the child face to face to the medical professional, where the medical professional put up some questions to really diagnose and find out what is really wrong with the child. He does that manually, and at the end of the day, he administers whatsoever treatment and drug he has for the child manually. But we have outgrown that stage with the aid of technology. Today, we have what is called in the health sector, there is what is called the clinical decision support system. This support system is an application that analyzes data to help healthcare provider make decision and provide patient care. It provides data, it helps you analyze, it helps you get all this data analyzed. With the help of this, somebody may not even need to ask too many questions. As soon as you get the fundamental questions, you use this app to analyze, and the medical professional will be able to come up with what may or what is the issue affecting the child. Remember, it is very important as children grow from infancy up to adulthood, especially at the stage where they are children from 3 to 11 years. It is in their health is important, their education is important. Technology has already come to take over every area, and we have established that technology had the bad side, and we are trying to harness the good side of technology to see the role that technology played. Now, there is another device, another technology that is called electronic medical record. It is an electronic digital collection of medical information about a person stored in a computer. We have moved away. There are so many technologies. We've moved to the third technology, which is the electronic prescribing. Before now, I think when we have medical professionals need to prescribe drugs, they does that manually and physically. But with the help of electronic prescription, which is an electronic version of the paper prescription. So the medical professional, in fact, can even use what is called telehealth to get information of a patient, of a child from a distance, and even prescribe drugs, and through the electronic prescribing, send the prescription to the pharmacist anywhere that is closer to the patient for the patients to get close to it and get it. Remember, we are combining this topic, the role of technology in health and the role of technology in education. I have decided to coin the initial topic from what it was, which is the role of technology in health and in education, to include what relates to my area, which is the role of technology in technology-based education. When you say technology-based education, in another word, you are referring to vocational-based education, or you are referring to technical-based education. Now, what is this education? Do we really apply technology in this aspect of education when we have to develop children? Do children need to develop psychomotorly their psychomotor skill from even this stage of childrenhood, of childhood? Do they really need it? If they need it, then there is need for us to look at the technology-based education and technology, how it can go hand in glove in the development of children in this 21st century. So the technical-based education is a form of education that focuses on the development of the psychomotor domain and enable students to acquire the skill and knowledge needed to succeed in the world of work. And of course, as you can see, we just cannot succeed at that level technically without even bringing in technology to have its way. It is designed to provide students the practical and hands-on learning experiences to earn a living. That is what is said about technology education. Now we are returning back to what is now the role of technology in health. A lot of researchers had looked at so many roles. There are so many important, so many roles, so many benefits of technology in health, so many. But for the sake of time and for the purpose of this discourse, I will be limiting all of that is in existence into just this few. I have developed a paper on this, and I think I included more of this into the work when I conducted the research. Now, first of all, it is very possible because of technology for health professionals to be able to disseminate health information from one place, maybe rural areas to urban areas, rural area to semi-urban areas, urban areas to rural areas, and so on and so forth, without wasting much time or without even needing the health worker or the patient physical presence. They can disseminate health information. Now, the technology also helps in improving the efficiency of administrative system in healthcare facilities to prevent medical error. It strengthens the ability to monitor the incidence of public health threats and response in a more timely and effective manner. Technology supports more effective health research and the discrimination and access to research finding. It facilitates public discourse and dialogue around medical health workers. It enables remote consultation, diagnosis, and treatment. A situation where you may not need to even come face to face before the medical professional, but you could be in a distant place, though irrespective of how far it is, and you can access e-health. E-health, where you talk to the medical professional, you tell the medical professional your issues, and the medical professional provide answers to the problem. If we bring this into the classroom, in schools where we do not even have a healthcare unit, and a child or a teacher develop an issue, you may not just need to panic to rush to the hospital. Just there in that rural area where there are no medical units in the school, you could stay there and talk to the medical professional, could be a doctor, it could be a nurse, it could be a pharmacist. You could stay and talk, and through the questionings, the professional will understand what the issues are, and also through that same means, send prescriptions to direct you to a pharmacist, send prescriptions, and you could be attended to. Now, also in education, technology plays a wonderful role. What are the roles? It helps students to learn very fast. It personalizes learning. It improves communication and collaboration. It provides teachers with more resources. Just like what we are doing, we are able to, I am in Nigerian, I am presenting this talk from Nigerian, far up to Indonesia. It is with the role, the advantage, the benefit of technology. It is made possible because of technology. Remove technology out of the scene, it wouldn't have been possible for us to rub mind, fertilize idea from as far as these two continents and countries are. But we could talk from here, and you could hear me loud and clear through the advantage of technology. Now, in this work, I have looked at related work. Is this concept of technology in health and education new? Is it new? Has it been researched upon? Had people looked at it, especially as it has to do with child development? Had other researchers, what are researchers talking about as it regards to all of these variables that we are investigating? If you look at here in the table, a lot of research work had been conducted where, especially in the aspect of health, where health professionals took their time to really find out if technology really promote healthcare delivery. And we have a lot of researchers. I have limited them to just 4 alone. If you check them with examine the potential of health technology to improve child health outcome by assisting and guiding parents and many others. Now we moved away from there, and sorry, if we go further away, we will now look at related work in education. So many researchers also have looked at the the benefit, the role of technology in education. We have all of them. Someone presented an overview of teachers' perception of the use of technology in teaching young children for childhood development. Another work had been presented on the technology integration professional development model for practicing teachers on the use of technology in early child education. And we have so many and so forth. For the sake of time, I have done this research, and I think I have forwarded it. The research has so many things that may not be mentioned here, which are contained in the paper, and which, of course, by the time it gets into the field, people will learn from it. We looked at all of this, and I tried to draw conclusion, especially as it has to do with the Nigerian situation. What is there is that even when I conducted this research and I tried to find out the frequency of use of technology in health and in education, I discovered that there is still lapses. Healthcare professionals are still finding it, in fact, difficult to use most of these technologies that are in vogue. And when you cross over to education, a lot of these technologies that should promote childhood development, teachers are still finding it very difficult to apply it in the classrooms. There could be a lot of factors that are attributed to why it is still very difficult, especially in these parts of the world, in this part of the world, Africa, in this part of the world, Nigeria. There are a lot of factors why this is so. But we hope that with time, it will be possible for these factors to be eradicated so that both health workers and teachers will be able to harness the potential, the gains, the benefits of technology in childhood development in their classrooms and in healthcare system or in healthcare delivery. Thank you very much for listening to this short presentation. I once again thank all of us, and I thank the organizers. God bless us.
Okay, thank you very much to Mr. Dr. T.R. Ariko Samson Benatius for the very informative and uh, inspiring presentation. Ladies and gentlemen, now come to the question and answer session. Okay, the rules are still the same. I'd like to have two questions from the participants. Okay, uh, the first question I'll be giving to Miss Alfi. Miss Alfi Rahmatullah. The question is, what is the biggest challenge to teach early childhood with technology in Nigeria?
The challenges to teach early childhood children, people of early childhood age here in Nigeria are so numerous. I think, first of all, to start with, the technological equipment are not even available in most of the schools. When I say most of the schools, majority of the schools, these technological equipment are not available to start with. Then when you look at the other challenges, you look at the electricity, poor electricity supply even in schools. You also look at the internet, the network facilities are not there in most of these schools. And apart from that, not much of the teachers even are technologically aware. Not many of them are technologically literate to even use the few technological gadgets that are in schools in the teaching of these children in schools. So you even find out that where we even have some of these equipment that are found in schools that are supposed to be for the benefit of these children, we have teachers who cannot use them. We have the system there who does not have electricity to function. We have the system there. When you talk about the technology, you cannot talk about it leaving away the internet, leaving away internet. We have these facilities that are there where they are there without even internet for them to be put in use. So all of these are factors that militate against the use of effective technology in the upbringing of children here in Nigeria.
Okay, thank you, Mr. Ariko, for the answer. And thank you very much to Miss Alfi for the question. And then the last question is from Miss Flora. The question is, we know that the technology can assist or help effectively all scopes of our lives, especially in education. Either lecturer or students need technology in this era. My question is how to handle remote areas where it is still hard to use technology due to internet connection. So many schools and campuses is areas can function the technology.
If I get your question very well, is how to use technology in rural areas. That is what you are talking about. How to use technology to train children in the rural areas. Is that what you mean? Hello? Can you hear me? If that is what you mean, how to use technology in the rural areas. First of all, technology can not be useful in an area where the facilities that can aid the use of technologies are not available. When you talked about the rural areas, you were talking about an area that is out at the outskirts, an area that is not in the town, that is at the outskirts. Now, for us to drive this technology, the benefit of technology to those areas, the government, the school administrator must be up to their responsibility. The responsibility of providing the internet to get as far as the rural area, the responsibility of providing the technological facilities up to the rural areas, the technology of even training the teachers in the rural area in the knowledge of the use of this technology. Now, if all of this is put together by the government, by the school administrator, the children at that level will benefit from the gains of technology. But if the government and the school administrator fails to do so, there is just no way even the people living in the urban area will benefit where these facilities are not available. So how do we get it work? Let the government come up and live up to their expectation by driving these facilities up to the rural areas. If these facilities are there and teachers are trained to use this facility, like one of the major challenges when I even say teachers trained to use, there are even some areas in the urban cities where these facilities are there. But because the teachers are not knowledgeable in the use of these facilities, the facilities are just there like monuments. They are there like monuments, like objects that are just standing fixed in a place without anybody putting them to use. So at the rural area, when government live up to expectation, provide all the the technological facilities in schools, and also train teachers appropriately for the use of this technology, I think a student will benefit from, or student will harness the benefits of technology for global advancement.
Okay. Thank you very much to Ms. Flora for the question, and thank you for the answer given by Mr. Dr. T.R. Aripo Samson Penatius. Very clear and easy to understand. I do apologize because we're limiting the question. So we move to the next session. Last but not least, we still have one speaker from our own homeland. Okay, let me read the CV of our fourth speaker. Okay. Next speaker, or the last speaker, her full name is Evania Yafi S.Pd M.Pd Evania Yafi S.Pd M.Pd Ph.D. Position lecturer in Teacher Education Early Childhood Education Universitas Negeri Malang. She graduated from S1 majoring in PG PAUD at the State University of Malang in 2012, then continued her master's at the State University of Jakarta, majoring in PAUD, and graduated in 2014, and he's completed her doctoral education at University Technology Malaysia in the Faculty of Social Science and Humanities and graduated in 2023. Okay, for work experience, her teaching experience began in 2015, starting as an educator at the preschool level until became a lecturer until now. And for research experience, she has a lot of research and community service experience at the national and international levels, including development of a mobile Android-based seamless project learning model in the course of playing games in early childhood in the PGPAUD VIPUM study program in 2019, and AI-powered learning modules, or AI-PELP, training to improve the digital literacy skills of PAUD teachers in Tumpang district in 2024. And for publication, she has published scientific articles both nationally and internationally, one of which is entitled Development of Smart P to Improve Parental Locus of Control and Children's Social Emotional Development, published by the Scopus Indexed International Journal of Evaluation and Research in Education. She has also participated in international proceedings and conference. The most recent one was the 25th PISIRA annual conference with the theme of children's well-being founded on reciprocal relationship at Akabinadai Campus Tokyo University, Japan in 2024. And there are many more of her works ranging from books to model works and applications that already have patients. The achievements obtained are also many, one of which is being awarded as the best finalist Special Kucha presentation in service learning by University Technology in Malaysia. Okay, and now she's going to present with the topic Smart Parenting and Education Using Technology for Better Health and Learning Outcome. Ladies and gentlemen, please join me in welcoming Mrs. Evania Yafi, S.Pd, M.Pd, Ph.D. Please, time is yours.
Thank you very much, Miss Rezen, or Raudatul Rezen. I'm sorry because my voice, I'm not have a flu, but I will be better, inshallah. And before I present, I would like to thanks and greet for Director of Institute of Technology, Science and Health, um, Dr. Soepraoen Hospital, Mr. Arief Efendi, and also Dean of Faculty Technology and Science, Dr. Juliati Koesrini, and also Head of Medical Report and Healthy Information Study Program, Mrs. Fita Rusdian Ikawati, and also all of the keynote speaker today. They are my best friend also from Nigeria and Malaysia, and also from ITSK. And also, I like to thanks for all lecturers, students, and my beloved participant in International Conference of Innovation, Science, Technology, Education, Children, and Health 2024. Today, I would like to share about part of my research in my doctoral. Actually, it's I will share about smart parent and education using technology for better health and learning outcomes. Okay, then I will share my PPT. Okay. Okay, it is clear?
Yes,
Okay,
Miss.
then. Okay, thank you very much. Okay, I want to ask you for all participants why you should use technology in health, parenting, and education. Because I think the less keynote speaker, they talk about how the important for technology in education. But if you know that the technology and learning, we can learn in the school, sometimes we can learn in the other place, and also the parenting is very important to know technology for increasing learning for student or children. So why we should use technology in health, parenting, and education? Somebody have a question about it before I explain? You can try to. It's okay. You can use Indonesian language or English language because I understand. Because now all participant, we have some participant in international. That's why I try to use English. So why we should use technology? Why we should? Anybody have a question? Answer? Okay, then I will next to the other slide because maybe somebody side to answer. Okay. 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 So the answer is for education, we can improve access equality for education because now, because maybe after COVID, all all the people they will change to technology for sharing knowledge and facilitate flexible learning Yeah, because we use technology, it is very flexible for us. We can learn anytime, anywhere, and what you want. I mean, if you wanna learn something, maybe you just remember something to learn. You just open the handphone or maybe open the laptop and search by using internet or application, so you can read everything that what you want, and then optimize teacher time and manpower. It's mean that you don't have some knowledge just for the teacher. We can meet the teacher, but we have limit time. That's why we can use the alternative by technology for getting knowledge for our information. So it is for education. And now why we should use the technology in the health, for health. The first, for improving access to health service. Sometimes okay, health is very biggest discussion about health actually, but we can try to know about our health. It's like reminding if we have some problem for our physically or mentally. So we use technology, we know when we can stop for our activity, when we can improve our health, and how to make practice for our health, and everything about health. Actually, maybe nutrition, maybe your growth, maybe your development. So we can know from technology. And early detection and management of chronic condition. Yes, sometimes we have information from technology or maybe some application. Now we have a lot application and also tools for technology. We can use every time, every day for our health. And we can reduce administrative operational errors. Yeah, sometimes we will like we not, or we feel like it's bad condition in our body, but we can go to the hospital, or in Indonesia we call puskesmas maybe, because it is Saturday, because this is holiday, so they are closed. So for technology will help you to give the first condition and how to give solution if your body is not really good. Or maybe we can use like chatting with the doctor for this time. Okay, and next, why you should use technology for parenting. So the parents sometimes they have a lot of big words, and sometimes we don't have a time to consultation with the other people, like a doctor or maybe physical psychology and psycholog, or sometimes we don't have a time to go to teacher on, or a lecture for about early childhood education. So easy access to the let's parenting information using technology, improving supervision and management of children activity. So we can give the parent about development, growth, access for information about their children. Okay, so building a support community for parents. And now also we have community support for parents. We give information with all the application and also like social media about parenting, like TikTok or maybe Reels for Instagram, Facebook, and also short YouTube. We have information about parenting. This is we can use the technology for help parent. Okay, then, but we have some problem about it. Okay, the first for education, for digital divide. We have 43% of the global population does not yet have internet access. UNESCO 2020. I think it's also, we have a problem in Indonesia. And also the gap between cities and village. 78% in cities we have internet, but 48% in village we have internet. So we can imagine also we have a problem if we use technology in the village actually. Okay. By BPS to 2020, and also teacher readiness to use technology. 60% of teacher lack confidence in using technology by OECD 2019, and teachers' digital competence are still low by PISA in Indonesia. So this is maybe the readiness about technology. For competency about the teacher, we need to upgrade. We need to improve for the teacher and using technology. Not all materials available online are of good quality or in line with the curriculum. Okay? So, Common Sense Media 2020 found that 37% of US teachers worry about the quality of online education content their student access. That's why for this actually for this study, we can make a material by teacher, by our, because we know the curriculum, how to capable, or maybe we need to know about their develop, their age, so we can make material by ourselves, by teacher, because they know what student needs. Yeah. For if you use social media, so you need to prepare, you need to compile, and you need to take for relate from student. I mean like that. Okay, next for health. Gaps in access to digital health service. Only 40% of the global population have access to telemedicine. WHO 2020. And difference in telemedicine adoption between urban 50% and rural 20% in Indonesia. So we have also different telemedicine here, because maybe our place is different, our structure, our weather is different by one place in another place. And then patient data security and privacy, only 40% of the global population have access to telemedicine, WHO 2020. And different, it is same. For this patient of data security, I think it's similar, because the data also, like the global and rural, they are different technique also, because the part of the place is different. Okay, for telemedicine service quality, 30% of patient feel that the quality of telemedicine service is lower than face-to-face. Yeah. Sometimes for the telemedicine is not directly clear, because sometimes we need to service, or we need to observe all for your health. So we the doctor can decide when you come face to face. Okay. So now we move to the challenges or problem at the parenting when they use technology. Children spend 4 until 7 hours per day in front of the screen. Yes, this is because the Common Sense Media 2020, they have study about it. Yes, now all the children So then they will study or play games or just watch YouTube, or sometimes they have activity for until 7 hours per day in front of the screen, even in laptop, maybe handphone. Now the children, they know about gadget. Okay, 73% of children in Indonesia experience increased gadget use during the pandemic. Kominfo 2020. Yes, it is true. I think you all parents in Indonesia also have a problem about it. Also, right? Okay. Difficulty controlling digital content. 45% of parents find it difficult to control content their children access of COM 2021. That's why the parent need to understand and attention about the children when they open the laptop or handphone. Or maybe you have some security for the content in your Wi-Fi on, yeah, your work. And also you need to give them the rules if they use play gadget. And lack of parental digital literacy. 50% of parents in Indonesia feel they lack adequate digital literacy by LIPI 2020. 2020. Okay, then. Okay. For need analysis 4. Technology offer big solution in education, health, and parenting, but challenges remain significant. So we need to observe what the challenges about technology for using for education, parenting, and also the health. Gaps in access skill, data security, and digital literacy are major barriers. Yeah, that's why we need to focus and attention about it. Improve access education and policies that support the safe and effective use technology are needed. Okay. Then this is just like example the technology for education. I think somebody here, doctor, lecturer, student, teacher, also maybe some of parent, maybe they using education for this, like learning management system. We use Google Classroom, Moodle, or we have AI like Duolingo, Ruang Guru, Socratic, sorry, and virtual reality VR like Google Expand Expedition and Class VR. Then technology for healthcare is like telemedicine, Hello Doc. I think in Indonesia we have that. Wearable device like Apple Watch, Fitbits, if you have, and also we can use handphone. I think they have like application to measure our step or our heartbeat, and also we can use yes, maybe watch hand watch, right? And also we have electronic health records like Epic System, Cerner, and etc. Now, technology for parenting and monitoring apps like the Wonder Week, Baby Connect, and etc. Parental apps control like Custodio, Google Family Link, and smart home device for parenting like Outlet Smart Sock, Nanit Pro, camera, and etc. Okay, then this is our study. This is our research about smart parenting with Smart P. We have actually 9 main feature. We have growth tracker, development, vaccination tracker, nutrition tracker, tips consultation, parenting assessment, and logbook. So, I will show you the application by YouTube. So I will share first. Sorry. I'm sorry. Hmm. Okay. Sorry. Okay, sorry because okay, the voice is not clear, right? I will try to okay, sorry. Share sound. Okay.
Feature is growth tracker,
So now it's
microcephaly
clear,
or
right?
other special conditions. Then, click the plus icon in the corner of the development update column. The plus button function to add growth data for children. Data entry includes development date, height, weight, and head circumference. If you want to add the latest development data, please fill in this section. After that, click Add Growth to save. Then, under the Development Update column, 8 main application feature menu are provided in the app. You can swipe the screen to the left to see the whole menu. The first feature is Growth Tracker. In the Growth Tracker, there is information related to the child's name, age, aspect of the child's growth, including height, weight, and head circumference. a graph of growth achievement, and a description of the child growth experience. In the graph, the horizontal line shows the child's age in months. The vertical line shows the magnitude of the child's growth rate. You can find out the progress of the child's growth through this line. Is the child's growth increasing well or decreasing?
Sorry.
Promo paling menantikan akhirnya tiba. Shopee 99
Listed. Underneath, there are several aspects of development including physical motor, social emotional, moral, artistic, cognitive, and language. Each developmental aspect has several submenus. In each sub, you can find various activities such as jumping, walking, and other activities related. Each activity has a description and progress milestone button. The progress button consists of number 1, 2, 3, and 4, which provide a description of what kind of achievements the child has in a particular activity, along with the stimulation that can be given. The third feature is vaccination. The vaccination menu contains a list of vaccines that can be administered to child. The list also contains information on when to administer the vaccine. To find out information about vaccine, you may tap on one of the vaccine names. It contains information about name, the timing of the vaccine, the benefits of the vaccine, general information about the vaccine, special notes about the vaccine, contraindications, immunizations pursued, and also the side effect of the vaccine. If the child has been vaccinated, click the vaccinated button as a marker. The display on the vaccine list will change to be thick as shown in the picture. The fourth feature is nutrition. This feature contains information on food recommendation on how to make food for breakfast, dinner, snacks, and drinks for children. When one of the menu is clicked, there is information about the ingredients, making procedures, and nutritional content and its benefits. The fifth feature is tips. In this menu, suggestions and tips are provided in the form of articles and videos regarding the stimulation that can be given to children. You can also search for information through the search field. The sixth, choose one of the expert categories, where 3 categories are provided, which are pediatrician, psychologist, and teacher. In addition, on the video stimulation, a video containing a child stimulation guide is also provided. Images and parenting. On the homepage, there is also a feature image.
Okay, for this app, you can also, maybe I will share to you our my PPT, so you can also listen by yourself in your house, because this is directly for our YouTube. So now let me back to our PPT. Okay. So this is for the benefit, yeah, from, I'm sorry, why? Hey, babe. Okay. After using SmartP, so this is benefit for children like health, receive proper nutrition and time reflection, achieve optimal growth and development. For education, benefit from a supportive and informed home environment. experience improve cognitive, emotional development, enjoy positive parent-child interaction, thrive in a well-monitored and nutrition environment. For parent, for health, better manage child nutrition and vaccination schedule, monitor and respond to growth and develop milestones. And for education, strength, knowledge, and skill in parenting, enhance understanding of child development and parental influence, and apply practice parenting tips, assess and improving parenting practice. How smart be impact in social and environment? Social outcomes, stronger family bonds, improve family interaction and relationship, enhance social support, better access to expert advice and community resource, because we have manual like consultation. They can use that for maybe sharing with the other people, and also they can have a question with other expert. And also improve child social skill, like children develop stronger social abilities through gauge interaction. For environment outcomes, resort parenting, effective use the community and health resources, sustainability practice, adoption of eco-friendly and health conscious parenting habits, optimize learning environment, creation of a home environment that support healthy growth and learning. So I think it is enough for my presentation. Thank you very much. If you have a question, maybe I will give back to moderator Revoedu. Thank you very much.
Thank you very much to Mrs. Efania Yafi, S.Pd, M.Pd, Ph.D. for the very informative and inspiring presentation. Okay, ladies and gentlemen, now come to the question and answer session. The first question, I will give it to Miss Sari from private chat. The question is, what steps can we take to ensure that technology not only provides great solution, but also protects the privacy and security of children and families? Okay, I will repeat it. What step can we take to ensure the technology not only provides great solution, but also protects the privacy and security of children and families?
Okay. Okay, thank you very much for your question. I will answer first because sometimes I don't want to compile. So the first tip is you need to have a good communication with your children. So give them give them understanding about how the positive and negative the content for for using technology. Give the rule how to use technology. Like for me, our child, they use glasses because maybe I will protect them for the radiation when they use technology. And also I have a limit time for them. Maybe I give them for technology after they go back in the school, but we have a limit time after they are learn or prepare their school book. And also we have rules like for holiday, they have a lot of activities, not using technology. We need the interactive like English, like basketball sport. So they will have minimum for using technology. And then we have the rules. We have also connection for like YouTube Kids, and we have protect for our Wi-Fi too. They can try to find or they don't have access for some maybe some of dangerous website. And Also, I have asked sometimes when they use TikTok, maybe I will always to accompany them, and I will talk. We make a conversation, discussion. This is good or not? How you why you use this? Why you blah blah? And sometimes we know this is positive, this is negative. You don't should watch this and anything, so they will understand. And also sometimes they will make sure and measure, oh, this is good content, or this is not good content, or this is make my mom side, and this is I don't want to. So they learn everything from technology, but they know how to, like, potential negative for them. Sometimes they will discuss for me, mom, this content is good or not. Mom, my friend, they wanna play games with me. The games is like that. This is good or not? Sometimes they will ask like this. This is the rule. That's why you need to good communication with your children, and also try to discuss everything, accompany them, and also make a conversation about this technology. And how about of if they very child, maybe like a newborn, oh no, not newborn, maybe 2 years until 3 years or 4 years, they don't understand about a positive and negative. So you need make sure them for technology, or the content for technology is good for your child. And also you need to make a limit time. If they are okay, it's so long for you, 4 hours for you, oh no, it's not good for your eyes, maybe like that. So please stop it, and try to give them a doll or play games with you. Just make them happy, but in another activity. It's not just in technology. I think this is a good idea for your child or children, and it is a keep for your make keep attention for your family with the conversation, actually, with the communication, because sometimes it's not just for technology, but sometimes they have information for another children, another friend in your environment. They know from technology, they know from YouTube maybe or TikTok, but your children will, okay, this is approved for me, it is not approved for me. But if you don't have communication, they will, okay, they will like your their friend will influence your children. So it's better your children will influence your friend. Oh, is this not good? So you need to be like that. Nah, I think this solution, if you want to protect your family and your children. Thank you.
Okay, thank you, Mrs. Evania Yafi, for the answer, and thank you to Miss Sari for the question. And then the last question, still related to the previous question, from Mr. Wildan. Massive use of technology in learning, including when children are at home. What is the role of parents at home who are less familiar with technology in learning, but want to control their children so that they don't overuse technology?
Okay, thank you, Mr. Wildan. Actually, maybe my last answer also have a connection with your question, but I will give you again for the solution for this. Maybe some of your family they not, like, some people they have grandmother, grandfather in their house. They don't know about the technology, but they control our children. So actually just communicate with them is the best solution. But it's not just communicate, but we give them a rule, we give them a lot of advice, and also for controlling them, we need to know how they like it, how the children like it. I mean, like, sometimes the children, I like basketball. I like playing football. I like to dance. I like to play games like drawing. Like my son actually they like draw, but they like draw with technology. But sometimes if we ask, don't use technology, but we can, because now it's like important for them to know technology, but in the positive ways. And if the technology you mean is like dangerous for your children, I mean like they have ethic in technology, they want to use a long time, and every time they want to use, if not they will angry. So it is a warning for you to make rules step by step. You need to try to explore what they like other than technology. Like sometimes you need to go alone on some park free time with your family, and sometimes we just okay we eat to outside and just love and with your family, just do it. So what is balance? You use technology, but sometimes you need to take your children for this activity, the other activity. Like you will go to the mountain, maybe you will go to the beach. In free time, you will go to in Malang. Maybe we can walk in Malang Heritage. Just make a free time and fresh air, and just give the another experience with your children. It's better. So if they are angry, just doing step by step. Don't like you also stop it now. No, like that. For me, if my children they just play game and also it is time to stop, I will ask them, please stop your game. Mom, I'm not finished now. Okay, after you have done level or this game finish, just stop it. I give you 5 or 10 minutes, so we can directly stop your children, because it make your children physiology is not good. So it's like have a trauma because your conversation with them. So give them like okay limit time, but you can use as soft what's the name soft conversation, and give your smile. It's like I care to you because I want you to stop this, because your health is better to communicate with them. So they know, oh, okay, mom, okay, dad, I know this is not good if I use this a long time. It's like that. So because now I think all the children they want to know about the reason why I need to stop, why I don't I can't use technology every time, every day. It's like that. So you need to give advice, you need to know also how to carry your children, how to communicate with them, and um how your children like it's like dance, sport, and anything activity. You need to give them all information, give them all skills. It's not just one skill and you don't care about them, because now they need to attention and care about for communicate every day, even just 10 minutes or 15 minutes before they sleep. You need to control them. Okay, maybe this is the solution. And also I also learn about it because I have a children. We learn together, don't worry. Yeah, thank you very much.
Okay, thank you very much to Mr. Wildan for the question. I'm sorry, but we're limiting the question. So thank you for the answers given by Mrs. Evania Yafi, S.Pd, M.Pd, Ph.D. Very clear and easy to understand.
Thank
Okay.
you very much, Miss Raudatur, and also all the question for the participant. And I think somebody have a question. You can also directly question with to me or community. Thank you.
Okay. It was a presentation from our 4 speakers who are very experts and extraordinary in providing positive insights. I will give the conclusion from our 4 outstanding speakers. In this ever-changing era, innovation in health and education is key to global progress. By utilizing technology wisely, we can create a healthier, better educated, and more connected world. However, we must also work together to overcome the challenge so that the benefits of this technology can be felt by all people. Ladies and gentlemen, this brings us to the end of our conference. I would like to thank all our speakers for their insightful presentations. I would also like to express my gratitude to the organizing committee and of course to all the participants for their active involvement. We hope that the knowledge and insights gained from this conference will inspire us to work together towards a healthier and more educated world. Let us continue to collaborate and innovate for a better future. Once again, thank you. Have a wonderful day. I'm Rodatu Razana Matdoan and see you at our future events. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon. Okay.
Thank you, Mem Razana. Thank you, Sir Aripo. Thank you, Mem Evan.
Thank you very much.
Prof.
You're welcome, Mr. Bayu. And then for participants whose names have been divided into Zoom rooms with certain numbers, please enter their respective Zoom rooms. Izin menggunakan bahasa Indonesia, buat rekan-rekan atau partisipan yang namanya sudah ada dalam room Zoom, silakan untuk masuk sesuai dengan nama rekan-rekan masing-masing. Terima kasih.
Terima kasih.
Terima kasih. Okay, see you later.
Thank you very much.
Thank you.
Thank you very much. God bless.
Yes, thank you. Assalamualaikum. Bye-bye.
Waalaikumsalam, Mrs. Efendi.